So hello everyone, I hope I'm audible and visible. Please give me a quick thumbs up if my audio video is fine, and let me check also whether I am visible or not. So yes, very nice all of you, and I think you all can see me now because yes. So today is the third session of the foundation course, and day before yesterday and yesterday we have done the basics of skin and the appendageal disorder. Today we will be doing a very important topic, and that is hypopigmentary disorder. Let me see why this has not come. Yes, okay, fine. So the pigmentary disorder is a very important topic because nowadays we are seeing a lot of questions being asked. Like if we talk about the NEET PG, you had a question on pigmentation previously, not this time. If you talk about FMG, again we had a lot of questions from the pigmentary disorders. So keeping both in the mind, we are targeting the pigmentary disorders in the today's session. All of you give me a quick thumbs up if you are ready. Welcome Paras, welcome to the session. And I'm also requesting those students, those who are taking or those who are every day attending my classes on your YouTube, please do come on the special classes or my paid classes. Very helpful and important for you to be the part of all the plus classes as well. So I'm Dr.Chesta Agarwal, and you are on the best online platform, that is Unacademy. This is the YouTube channel. We have a very amazing app which is known as Unacademy Learning App. You can download the app from the App Store. You can choose your category, that is NEET PG. And once you do this, you will have two options. One is the free classes, which are known as special class, and another is paid classes. Okay, so we have free classes and we have paid classes. The free classes are known as special class. They are the interactive classes with the option of poll. You have raise a hand feature. You will never miss a class. The lecture notes are available, and you can attend the class anywhere, anytime with any of the the electronic device. If you like the special classes, we have paid classes which are known as plus, which give you an access to Unacademy live classes from the top educators. Unacademy live classes from the top educators. You have access to both live and recorded sessions. We have access to the quizzes, test, and around 25,000 plus questions are available. On Iconic, you have both access to Unacademy and Prep Ladder together. You have access to both Unacademy and Prep Ladder together. On Prep Ladder, we have video lectures, question bank, rapid revision snapshots, or clinical integrated essentials. Now on Unacademy, we have recently updated the platform with the high yield clinical questions, which are based on the latest exam, and it includes the detailed explanation of these questions. We are proud that we have a lot of learners who have achieved very well in their respective exams, and let's see, we are awaited with the results of the NEET PG also, and we are assuming a lot more students being a part of this leaderboard. Now the batches which are planned for the month of September, that is from 15th, these are the next batch which will start from 15th. I will be teaching you the dermatology, the classes starting from 15th, and in FMG batch also I will be taking dermatology. The classes are starting from 15th of this month, 15th of September, from 3 to 5, 3 p.m. to 5 p.m. Okay, the classes are starting from 3 p.m. to 5 p.m. very important. Okay ji, all of you Paras and all my dear students. Now there is another batch for those who are targeting the NEET 2022. We have introduced a clinical examination and a procedure batch, where a lot of clinical examinations and discussions will be done. You will have the skill and procedure related stuff which will be taught to you. So that is something which is very important for you right now. Now we have some offers for those who want to take a longer subscription. For example, like if you are in your final year right now or pre-final year, take a longer subscription of 24 months and do get a 4-month free for it. And if you get it for 12 months, you will have 2 months for free. Now this is the NEET PG subscriptions, either Iconic or Plus, whatever you have you can take it. For Iconic you have 12 month, 18 month, 24, 36 and 48 month. Whatever you use, please use my referral code CHESTA10 so that you have additional discount. For Plus, you have shorter subscriptions of 1 month, 3 month and 6 month available. If you are targeting the FMG exam, you can take a shorter one. Otherwise, the 12 month would be sufficient. And using the referral code CHESTA10 will give you amazing discount. So please start it ASAP. And lastly, we have a bug bounty program that if you have any inappropriate content, you can claim and report your price. Chalo ji. Very nice. Now we will start with a very important topic today. Before discussing the questions, we will start with a very important point, that is what are the pigmentary disorders and how they are broadly classified. Pigmentary disorders means anything related to the color of the skin. Pigmentary disorder means anything related to the color of the skin. Okay, we have two types. We have two types of pigmentary disorders. One is hypopigmentary and another is hyperpigmentary. Hypopigmentary or hyperpigmentary disorders. Hypopigmentary and hyperpigmentary disorders. ठीक है जी, very important. The hypopigmentary means the skin color is not getting formed. There could be two reasons why the skin color is not getting formed. One is there is no melanocyte. Melanocytes are the pigment forming cells. If there is no melanocyte, obviously there will be no pigment. But there is another scenario when the melanocytes are normal, but they are not able to perform or not able to form melanin. Understood, Paras and all the other students? How does the pigmentary disorders classified? Please give me a quick thumbs up if you understood this point. So we have a hypopigmentary disorder, no melanocytes or melanocyte present but no melanin. Similarly, hyperpigmentary disorder can be because of two things. One, either there is increase in the melanocyte count. There is increase in the melanocyte count, or there can be increase in melanin synthesis. There is increase in the melanin count or there is increase in melanin synthesis. So two type of pigmentary disorders, hypopigmentary and hyper. Hypo means either no pigment or no cell, or hyper means either increase in the melanocyte count or increase in the melanin synthesis. Now we will tell you a little bit about the pigment formation and then we will start with the today's question. Okay? Then we will start with the today's question. So we need one more blank page. Can you tell me what is the cell of origin of melanocyte? Anyone? What is the cell of origin of melanocyte? Can you answer this for me? Paras? What is the cell of origin of melanocyte? What is the cell of origin of melanocyte? It is a neural crest derivative. It is a neural crest derivative, but it is present in the skin, which is an ectodermally derived tissue. It means that during the process of embryogenesis, it has traveled all the way from neural crest to the skin. Clear? So melanocyte is an immigrant cell which migrate from the neural crest, up to the skin during the embryogenesis. ठीक है जी. Now, what are the precursor cells which migrate? The precursor cells which migrate are the melanoblast. ठीक है? So these melanoblasts migrate enters the skin through dermis, and then finally it reaches to its destined space, that is stratum basale of epidermis. And this whole process of migration occurs during embryogenesis. I hope this is clear and there is no much of confusion that melanocytes do migrate. Now, for the process of migration, you need some factors, and these factors are known as steal factors. So just think logically, if anything happens to these steal factors, what happened? Paras, can you tell me, if anything happens to this steal factor, what happens? The melanoblast will not migrate and it will not reach to the epidermis. So you will see hypopigmentary disorders with no melanocyte count. Clear? Understood or not? So that is a basic thing which you need to know with respect to the pigmentary disorders, and I want all of you to solve this question. This was a direct question being asked in so many exams. FMGE, INICT, recent, I'm not talking about old, I'm talking about recent FMGE and INICT papers. ठीक है जी, recent exam. The lady came with unilateral white skin lesions with leukotrichia as shown in the image. What is your likely diagnosis? Very nice, Paras Patel. Everyone, very nice. So here you can see that you have depigmented lesions on one part of the face in a linear pattern. You can see that you have depigmented patch on one side of the face in linear pattern. This becomes a classical diagnosis of segmental vitiligo. This becomes a classical diagnosis of segmental vitiligo. Very nice, Sparrow, Patel and Paras, and this was a repeat question which you can get in your exams. What is piebaldism? Hypopigmentary disorder. It is a congenital hypopigmentary disorder. Chalo. So one more thing, one more image or blank paper we need. So the hypopigmentary disorder are further divided into congenital or acquired. Hypopigmentary disorder is further divided into two broad groups: congenital and acquired. What is the congenital hypopigmentary disorder? Congenital is oculocutaneous albinism, piebaldism, Waardenburg, then Chidak-Higashi syndrome, Hermansky-Pudlak syndrome, Griscelli syndrome, Nevus depigmentosus, etc. While acquired, the very important one is vitiligo. In vitiligo, you have autoimmune T lymphocytes. You have autoimmune T lymphocytes which goes and destroy the melanocytes, and that is why you see hypopigmented lesions. Now, I totally agree with you that it is very difficult to know how to differentiate between focal from segmental. Please remember, segmental vitiligo is present on a single dermatome. It never crosses the midline. It is present in a single dermatome. But focal vitiligo can cross midline. It can present focally in different dermatomes also. So that is how you can differentiate a segmental from a focal vitiligo. So Paras, Sparrow, Pri, Vansh, everyone will give me a quick thumbs up if you understood this point. If you understood this point. Okay? Okay? Please give me a thumbs up if you understood. Very well done. Chalo ji, बढ़िया, amazing. Yes, focal can have spot everywhere, so we cannot say sparrow, but you can see multiple focal spots. Okay, if you see the focal spots everywhere, then this can be confused with the generalized vitiligo also. Let me see if I have the images here for you or not. I think I have the images. Okay ji. So this is how you can differentiate a segmental vitiligo from a focal vitiligo or a generalized vitiligo. So this is a generalized vitiligo where you have more than one segment or area is getting involved. But if you have only small areas, then it is known as focal. This is a case of segmental vitiligo. Very, very interesting. Then we have Koebner's phenomena. I hope you know what is Koebner's phenomena. Koebner's phenomena means on friction, patient develops the lesion. And here you can see that because of the undergarment, the patient have developed classical vitiligo lesions over those areas. So very well done all of you, very nice. Let's move to the next question given on your computer screen. Let's move to the next question. Please tell me the answer. A, B, C, D, E mnemonic is used for. A, B, C, D, E mnemonic is used for. Very nice, very nice. This is a frequently asked question. I think we have seen a lot of questions on this particular topic. Yes. So A, B, C, D, E mnemonic, it's not actually a mnemonic, it's a diagnostic criteria to look for the conversion of the benign lesions into malignant. Very, very important for melanoma. What is A, B, C, D, E criteria? First of all, what is melanoma? Can you tell me what is melanoma? Whenever you have abnormal proliferation of melanocytes, when melanocytes abnormally proliferate, they give rise to a large structure, or they give rise to an abnormal structure which is asymmetrical, irregular border, difference in color, known as malignant melanoma. Sometimes what happens, the benign lesions, for example, if somebody is having a benign melanocytic nevus, it was a particular shape or size since a very long time, but suddenly it started changing its shape, or it started increasing from one side, or the color becomes abnormal, the diameter becomes more than 6 mm, then everybody has to suspect that it is a case of malignant melanoma. Okay? So A, B, C, D, E mnemonic, E is for evolution. A, B, C, D, E mnemonic is a very, very classical question or image for the malignant melanoma. This is another very important question, a very, very interesting question as well. Please tell me the answer of this question. Amazing, all of you, very nice, very nice. So a lady complains with the bluish lesions over the left side of the forehead and on the eyes, an irregular bluish lesion in the left superior conjunctiva and the forehead is seen. What is your diagnosis? What is your diagnosis? So this becomes a case of, I hope I am visible to all of you. This becomes a case of nevus of Ota. Now, if you remember in the beginning of the today's session, what did I tell you? In today's session, I have told you that you have two types of pigmentary disorders, one hypo and one is hyper. The hyperpigmentary disorder can be because of increase in the melanocyte count or can be because of increase in melanin synthesis. Now this melanocyte count can be increased either in the dermis or in the epidermis. If it is increasing in dermis, you have three examples: nevus of ota, nevus of Ito, and Mongolian spot. And if it is increasing in epidermis, then you have freckles, lentigens, melanocytic nevus, Becker's nevus, etc. Understood, Sparrow, Venkatesh, Pri, Paras, all of you? So hypopigmentary disorders or hyperpigmentary disorders can be in dermis or can be in the epidermis. Now if it is in the dermis, the color of the lesion becomes little different and it appears blue in color. While if the pigment is present or the melanocytes are present in the epidermis, it appears brown in color, and that is how you can differentiate both of them. So nevus of ota and Ito, both of them are blue in color, but the difference is nevus of ota is over the distribution of trigeminal nerve, while nevus of Ito is on the scapular region, while Mongolian spot is on the lumbar area. The Mongolian spot is in the lumbar area. Mongolian spot is in lumbar area. Okay? So we have nevus of ota, we have nevus of Ito, and we have Mongolian spot. Okay, ji? आगे बढ़े. Should we go to the next question? Any confusion? Anyone has any confusion with this particular one? Chalo, fine. Now let's discuss the another question. Achha, we have one more image for Mongolian spot also. So Mongolian spot is over the lumbar area, and nevus of ota and Ito is over the scapular and trigeminal respectively. Okay, Tariq? So I think these images, they are self-explanatory. You can see blue color. Why blue? Because the melanocytes are in dermis here, while in freckle, lentigens, where the melanocyte in epidermis, they appear brown in color. The dermal pigment is blue. Now epidermal nevus follows. Epidermal nevus follows Blaschko's line, Langerhans line, vascular lymphatics. What is the correct answer? Very nice, Tariq, Pre, Sparrow. The correct answer is option number 1. What is Blaschko's line? These are the embryogenic lines, and through these lines the precursor cell migrate from the neural crest or from one part of the body to another part. We have total 4 types of Blaschko's line. One is the linear pattern, then you have a broad pattern, then we have checkerboard pattern, and we have a petalloid pattern. So these are some of the types of Blaschkoid lines, and all these epidermal nevus or any sort of nevus, they tend to follow these Blaschko's line. Clear, all of you? You can see that epidermal nevus is this. You can see that it is following the Blaschko's line. Very, very clearly you can see that it is following this linear Blaschko's line which we have shown. Now identify this condition of hypopigmentary patch. Very nice. Identify this condition of hypopigmented patch, linea nigra, tinea cruris, Cronkite Canada syndrome, and pityriasis alba. What is the correct answer here? Very nice. This is a classical case of pityriasis alba, which is a endogenous eczema. They present with ill-defined hypopigmented patches which can be scaly or itchy and very common in young children, specifically a pre-adolescent age group. Okay? Now, a few options. What is chronite candida? This is a pigmentary disorder where you see a lot of pigmentation of the scalp, palmoplantar region, and even the nails are distorted. Okay? Now, identify the following lesion. Identify the following lesions: Becker's nevi, hypopigmented macule, Spitz nevus, or epidermal nevus. Please tell me the answer of this question, everyone. Amazing. So identify the following lesions. You can see that the color of the lesion is brown. When it is brown color, you are sure that you are dealing with an epidermal melanocytic proliferation. It could not be Becker's nevus. It could not be the nevus of Ota. It could not be the nevus of Ito or Mongolian spot, because all the three are the examples of the dermal pigment. But here you can see that it is brown in color, and can you appreciate this increase in the hair? Can you appreciate this increase in the hair? This is something which make it different from all of them, and this is a characteristic feature of Becker's nevus, where the nevus cells have associated androgen receptors. And what happens because of these associated androgen receptors, they become very prominent during the puberty. They have increased hair, or sometimes even the acneiform eruptions can be seen. So identify the following condition. The answer here is the Becker's nevus. Very classical on trunk, occurs on the adolescents, and they have associated hair or acne form eruptions here. Clear, all of you? Again, requesting, if you have any difficulty, please try to just subscribe to Unacademy so that you have a lot of revision or practice. Now we have some practice questions for all of you for what we have done. So I want everyone to mark this up. Few practice questions for everyone. Very nice. Practice question for the pigmentary disorder. Now here there is a very important point, that what are the epidermal melanin disease? What did I tell you just now? That nevus of Eta, Mongolian spot, they are the dermal melanocyte. The only correct answer is option number 2 and 3, that is Becker's nevus and freckle. So the answer become number 2 and 3. Very easy, we have just now did it. Another is an assertion reason type question. Can you solve this? Can you solve this question? Very nice. Very nice, all of you. The topical hydroquinone is effective in melasma, or hydroquinone is a tyrosine inhibitor. What is the correct answer? Whether it is true or false, whether the assertion is right or not. Very nice. The correct answer is option number 1. Now, what is this hydroquinone? Melasma, which is a hyperpigmentary disorder. The reason for hyperpigmentation here is not increase in the melanocyte. Here you have increase in melanin. Here you have increase in melanin. So what happens when the melanin increase? You have increased conversion of tyrosine to melanin with the help of enzyme tyrosinase. So for taking care of the melasma lesion, you need to give something which inhibits the tyrosinase, and that is hydroquinone. So the correct answer is both of them are the correct statement with the explanation of each other. Coming to the next question. Please tell me the answer. Very nice, all of you, very nice. The correct answer of this question is the blue color pigment on the face. We have just now discussed that in nevus of ota you will see a blue color pigment which is present on the scalp. So very well done, Sandhya, Sujit, Tariq, Pri, everyone. I think this is a very easy question. We have another one. Very nice. Please remember, in a patient with vitiligo, the next test which you will do is a thyroid profile. Now we have just now discussed that vitiligo is an autoimmune condition. Autoimmune condition where you have autoimmune T lymphocyte directed against the melanocyte. Now remember that autoimmune conditions are always present together because these autoimmune cells are not specific to one particular site. They will keep on destroying the other areas also, and that is why you see the thyroid disease, you can see the blood disease, you can see melanocytic disease all together in a single patient, and the most frequent association is with that of thyroid. That is why the next best step which you have to do is option number 1, that is full thyroid profile. Okay? So very well done. With this we are done with today's session. Thank you all of you. I request everyone to please subscribe to the YouTube channel Let's Crack NEET PG. Also follow me on the Telegram group. The name is same. You can subscribe to Unacademy using the code Chesta10, which will give you additional 10% discount. And lastly, please don't forget to press the bell icon and give me a thumbs up if you like this video. Bye bye.